Well, welcome everybody. Today is unbelievably May 12th, 2021. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth Hitchcock Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. And on the show today, I'm very excited. We're going to be discussing tick-borne illnesses with our state public health veterinarian, Dr. Natalie Quitt. Thank you for joining us, Natalie.
Thank you for having me.
Did I pronounce your last name correctly? I should have asked you that prior. Okay, awesome. So Natalie leads the health department's zoonotic and vector-borne disease program, including surveillance, prevention, investigation, and response, which is an incredibly awesome title. Do you actually have that on your business card?
No, there's not enough room. I think state public health veterinarian is long enough for a business card.
Oh, I love it. She received her doctorate of veterinary medicine from the University of Illinois, master's of public health from the University of Minnesota. She's worked as an epidemic intelligence service officer for the CDC and has worked as a small animal practitioner, a wildlife medicine volunteer. She must have started at the age of 4 to get all of that done. So just tell us a little bit about your background, where you grew up, and then how you ended up in Vermont.
Sure. Well, I was not born and raised in Vermont. I was born and raised in Chicago, Illinois. So definitely an urban environment. But I always loved animals and the outdoors and always had a menagerie of different pets. So naturally, I always wanted to be a veterinarian. And as you said, my background, I went to the vet school and then practiced small animal medicine for 5 years. And during that time, volunteered in wildlife medicine and got really into One Health. And worked towards a master's of public health during that time. And then I had the privilege of doing a fellowship at CDC, as you said, called the Epidemic Intelligence Service, before my current role as state public health veterinarian at the Vermont Department of Health. And that's what brought me to Vermont. It was a mixture of the timing of finishing up my fellowship and the opening of the state public health veterinarian job, which is was my goal after the fellowship. And then I liked Vermont for its access to outdoors, its smaller population, and all it had to offer.
That's great. So are you a trail runner or a hiker or a climber? What do you mean when you say outdoor activity?
Yeah, so I really like doing, and particularly during pandemic times is a good time to get into the outdoors, although I always love the outdoors. So I really like hiking, running, and like you said, trail running, camping, biking, particularly gravel riding, which is a new thing I learned about in Vermont with all the gravel roads. And in the wintertime, most often cross-country skiing. And all of these activities I do with my dog, include her on all those. And then I also like to read and watch movies in the horror zombie genre. And I can't wait for post-pandemic times where I can partake in karaoke again.
Oh, that is awesome. So were you stuck in Atlanta when you did your fellowship for the CDC?
No, luckily, I mean, there are different assignments you can do with the Epidemic Intelligence Service. Most are in Atlanta, as you say, different headquarters positions. I was in a headquarters position, but in the CDC office in Fort Collins, Colorado, where they have their division of vector-borne diseases. And they have 2 branches in that office, and I was in the bacterial diseases branch that focuses on bacterial diseases of tick-borne origin.
So when you say vector-borne, why don't you tell the audience a little bit about what that means, or what that means to you and what that may mean to them?
Sure. Vector-borne diseases mean those diseases that can be transmitted to humans through an arthropod or insect vector. So that individual or human needs to be bitten or exposed to that vector to be exposed to the pathogen that vector is carrying. So
ticks being one.
Yep. Mosquitoes another. And then, believe it or not, there are some others like fleas in particular.
Oh, yeah. And bubonic plague and some of those other ones that we hear about and actually still exist, but not around these parts, but maybe where you were in Colorado.
Right. Yeah. Luckily, we don't have plague here and not so much tularemia, but we did see those out west for sure.
Sure. And actually, where I was in Memphis, Tennessee, we used to see a lot of tularemia, and then you come up here and you don't. But we also have so much Lyme disease, so much tick-borne illness, which is what we're going to kind of go into today. A lot of people feel that the tick-borne illnesses are new, quite new in Vermont, but they've probably been here for longer than that. Can you just tell us a little bit about the history? And you can just ad lib on this question as much as you want.
Yeah, sure. So I guess they are pretty new, but I guess the oldest one that we see in this area is Lyme disease. And that was first identified in the 1970s in a place called Lyme, Connecticut. And that's where it was first discovered. And at that time, the etiologic agent or the actual pathogen wasn't known, but there was a cluster of arthritis-like symptoms in children. And not until late 70s was it identified that that syndrome in children was being caused by Ixodes scapularis, or the black-legged tick, which is the most abundant tick that we have in the Northeast. And then not until the 80s was the actual bacterial agent discovered to cause Lyme disease, and that is Borrelia burgdorferi. And so I would say, as far as Vermont goes, reports of Lyme disease were rare. And in the early 1990s, the health department only received about a dozen or fewer confirmed cases of the illness each year. And since that time, the number of reported cases has increased substantially. It's now common to see over 500 cases each year. At most, we've had just over 1,000 in 2017, and I think in 2019. And so since then, other tick-borne diseases have emerged in Vermont. We have babesiosis, anaplasmosis, and Borrelia miyamotoi disease. And emergence of these diseases are attributed to many things: the tick distribution and ecology, the pathogen life cycle, the intermediate hosts or mammal distribution and movement, and human behavior. And of course, you only have human disease where there are infected ticks and where they come into contact. And so in Vermont, we have black-legged ticks in every county, but geographically, the southern half of the state is most affected by the tick-borne diseases we see in Vermont. And over time, we've been monitoring those, and we see that reports of illnesses are started slowly kind of creeping northward through the state.
Right.
So it's important to remember to prevent tick bites wherever you are in the state.
And that's exactly right. That's the key. That's what I've also learned as both an emergency medicine physician and a trail runner with dogs, that prevention, we can talk about recognition, and we will, we can talk about treatment, but if we can just prevent it from the onset, that's so important. And I do want to get into that. I'm actually going to go right into something real quick that I think sometimes we avoid, and you brought it up, and that is tick-borne illness first occurred in the 70s and was sort of recognized slowly. But because it took a time to recognize, and because people were suffering, and it took a while for physicians, veterinarians, and others to understand it, there developed this sort of doubt among the public and some concerns with trust. And that, unfortunately, still holds true today. But I can say, fortunately, we now understand great deal about the disease. Everything you've said in these first 10 minutes was not known even 20 years ago, or at least not widely known. And so physicians and healthcare providers are trained to recognize the disease and trained to treat the disease. And we do have some questions at the end about treatment, which we can go into. Let's just talk about some of those non-Lyme diseases real quick, because they are important. In fact, in southern Vermont, about 2 years ago, anaplasmosis sort of overtook Lyme in prevalence, at least by the testing. So let's just call them equivocal in their prevalence. What about babesiosis? How much babesiosis is the state seeing reported?
Yeah, so just quickly on Lyme is still our most common tick-borne disease in Vermont. Like I said, we see anywhere from 500 to 1,000 confirmed and probable cases each year. Anaplasmosis is a close second, and actually still steadily on the rise. We've seen over many years a slow rise in Lyme disease cases, but anaplasmosis seems to be kind of a quicker rise, where we're seeing 200 to 500 cases per year. And then babesiosis is our third most common tick-borne disease in Vermont. And during 2005 through 2018, we have about an average of 8 cases per year. So a lot less. But important to note about babesiosis is it's not a bacterial disease like Lyme disease and anaplasmosis. So it's not susceptible to the common antibiotics that we have. So it's really important to recognize that disease in a patient. And you can have co-infections as well. And then lastly, we've got another one that I mentioned that's very brand new to the state and to the region in general. Is called Borrelia miyamotoi disease. So it's a bacterial pathogen related to Lyme disease. It's also a spirochete and also susceptible to the same antibiotics that we use for Lyme disease. We first found it in the state, or was reported in the state in a human in 2016. And then to date, we've only had about 40 Borrelia miyamotoi infections. And the important difference to make between the other 3 diseases and Borrelia miyamotoi is the other 3 diseases are nationally notifiable, which means we have a national case definition. We're required to do surveillance for them and report up to the CDC that those are happening, so they can aggregate those case counts and report it on a national level. But Borrelia miyamotoi is not yet a nationally reported disease, but we have made it as reportable in our state, so we can make sure we are keeping track of those cases, and those are being reported to the health department. We are detecting them, so we can keep an eye on how many people are affected by that disease each year.
That's great. And I will say to add to some of that as far as recognition. So the state only knows what's reported to them, and testing does vary. Fortunately in Southern Vermont, and actually most of Vermont, but I'm reporting here from Southern Vermont, we actually have a testing that we've arranged with our infectious disease physician, Dr. Marie George, as well as several primary care physicians, and then our laboratory. And we typically test for all diseases. We've got a bundled test. The initial cost is a little bit more, but then the gain is incredible because we get results on all of those. And you can have that co-infection, which is how we picked up the babesiosis in this area. So that's important. I know people get concerned about testing. They read on the internet. I will say testing has advanced tremendously, and anywhere in Vermont, you should be comfortable with the test that your provider is running. When we go talk about, go ahead, Anna.
I was just going to add something about, you made a really good point about surveillance as well. And I just want to follow up on that it's not perfect. We can only report on, and so our numbers are estimates. So we can only report on what, aggregate numbers of what we know about. So it takes someone going to the doctor, getting tested, and then reporting it to us, and then us getting the information we need to classify it as a case based on those national case definitions. So I just want to make sure that everyone knows that these are estimates. There could be more cases out there that we don't know about.
Right. In fact, there certainly are. Many physicians with classic presentations are very comfortable treating uncomplicated Lyme anaplasmosis based on symptoms without testing, and we don't need to. And the treatment is effective, and so everyone needs to be. I have had patients be concerned when testing isn't done, and it's not always indicated. Again, it's good collaboration with the state and infectious disease experts in that realm. So we learn a lot, or we tell patients a lot about the life cycle of a tick. If you go to any website, including the Department of Health's website, it always throws this up and it talks about the mice and the deer. Why is that important that we understand that as scientists, and why do patients care, do you think?
So what's important about the tick life cycle and the diseases that we see, the tick-borne diseases we see in Vermont, is that they're all transmitted by the same species of tick. So, which is great because then all of our same prevention measures will help to prevent all of those diseases. So they're all transmitted by the black-legged tick, Ixodes scapularis, and it has a 2-year life cycle in 4 stages. So it's got egg, larvae, nymph, and adult. So after hatching from eggs, the tick needs a blood meal to move to the next stage of each life cycle. So that's the important thing. Number 1 is they need to feed on a host. So that can be an intermediate mammalian host or bird, or it could be a human, it could be a dog. So tick larvae that are hatched from eggs are not hatched infected. They're not born infected. And so they need to feed on an intermediate host that is carrying the pathogen of whatever, disease we're talking about. And then once they molt into their next life stage, that tick is then infected and then can transmit to another host, whether it be another mammal or a human. And humans and dogs are considered sort of incidental hosts, but then they cause disease in humans. So the important thing about these tick life cycles is that we see ticks only abundant certain times of year. And so that helps us understand too, and how to detect the disease in people when they come to their doctor's office. So ticks, tick nymphs, which is the stage after larvae, are most abundant in the spring and summer, and they're the most are the biggest culprit, I would say, for transmitting Lyme disease and anaplasmosis to humans. So we do see a rise in cases most often in the summer. And then it's important to note that we do get a bump in adult ticks in the fall, who are also capable of transmitting Lyme disease and anaplasmosis. So we kind of have this secondary hump, especially in anaplasmosis in the fall. That's when adult females are getting their last blood meal before they go dormant for the winter.
Wow.
So so it helps us understand when to be most on the lookout for ticks and prevent tick bites.
That's great. Yeah. And as far as in our own system, our own health system, the diagnosis, of course, mirror that. We do see people with sequelae or first identification, particularly of Lyme disease, in off months, but very few, in the single digits, as opposed to the summer months, spring months, where we can hardly even count the number of patients that come in. Fortunately, the treatment is very successful. But before we get into the treatment, let me just ask you a little bit about what do you do personally? So I'm going to make this a personal question in prevention, especially considering the fact that you have a running partner who has 4 legs.
Yes. So I like to break down tick bite and tick-borne disease prevention into 4 things: protect, check, remove, and watch. So first, protect, right? Avoid where ticks live. They live in wooded, brushy areas if you can avoid it. So stick to the center of the trails. Unfortunately, our four-legged friends like to wander a bit more, and so they're more prone to getting those tick bites. Yes. And we know that's a risk for humans because they can carry ticks inside. So before going out, especially during these, like I said, these most abundant tick times of year, wear EPA registered tick repellents on yourself. I like to also treat at least 1 or 2 pairs of clothing or outdoor clothing with products containing permethrin. And that is something you spray on your clothing, not on yourself, and it lasts through several washes. And that's really effective on preventing ticks getting on your body. Similarly, talk to your vet about what tick prevention products is best for your pets, for your cats and dogs. There are spot-on treatments, chewable tablets, there's collars. And then for one other protect step is cover up to keep ticks off your body. Wear light colored clothing so you can see ticks crawling, you can brush them off. And then you have actually a barrier between the skin and ticks. And then if, after being outdoors, you want to check for ticks. That is a really important step. Don't let them hitchhike inside on your clothing or pets. So you can immediately remove the clothing that you were wearing outdoors, put it in a hot dryer for 10 minutes. That'll kill any ticks that have been crawling on your body. You want to check your whole body for ticks soon after being outdoors. One good method is showering soon after being outdoors within 2 hours. It washes off any unattached ticks and gives you a good opportunity to check all over your body. And so if you do find a tick attached, obviously if it's not attached, you could brush it off and dispose of it. But if you do find one attached, you want to remove the tick as soon as you can. The longer a tick is attached to your body, the more opportunity there is for a transmission of the pathogen it might be carrying. And stick to removal methods that are proven to work. There are some methods that are not proven to work, like using petroleum jelly or a match or things like that. And then after removing a tick, you always want to watch for symptoms of tick-borne illness. for, at least 30 days after you've taken off a tick, especially if it was on your body for more than 24 to 48 hours. And then if you do get symptoms or feel sick, such as like a flu-like illness in a weird time of year like summer, I know COVID kind of complicates that these days, but talk to your healthcare provider if you feel ill.
Absolutely. So I have to emphasize something. I'm so glad, Natalie, to hear you emphasize something that I also emphasize. And so if you say something I agree with, of course, I'm going to love it, right? And that is taking a shower after being outdoors. That's not emphasized enough. And actually, I've seen people who are kind of nervous to go on a hike or nervous to get out because they're so worried about ticks. And we don't want you to be worried about ticks. Being outdoors and experiencing life is so important. But when you get back and you've checked yourself, as Natalie says, and you've looked at your clothes, taking that shower is incredibly effective. As she said, removing the unattached ticks, but it gives you that opportunity to do that self tick check. We all come in and plan to, and then something happens, the phone rings, we get busy and we don't do it. And the next thing you know, we've gone to bed and forgotten about it. So taking that shower is so important. We did have a couple of questions about treatment. I just want to jump into, there were some questions about what novel treatments are out there, what's the current treatment. So the current treatment remains highly effective, and that's typically doxycycline. You can use amoxicillin if you have a problem with doxycycline, but doxycycline is generally well tolerated. The duration is 10 to 21 days for most tick-borne, not the babesiosis, but the other 3 tick-borne type illnesses in this area, sometimes up to 28 days for certain neurologic symptoms. I'm going to stop there because it's a lot more of a discussion we can go into on another show, but really important for you to have in the audience with your physician. I know that there are some that push for much longer treatments with doxycycline that has not been shown to have any greater effect. But again, you can have that conversation with your provider. And on removal, I think there are maybe 833,000 ways to remove a tick, depending on who you're talking to. I will say there are some, you have to try the different ones that Natalie was talking about looking online, but there are some that just don't work as well as others. And one that really works for me, and I'm just going to tell you my own experience in the emergency department because we remove ticks off people all the time, is to use this, it's called a tick key. I wish I had one. I probably do, but by the time I found it and brought it out, we'd be done with the show. It's something that costs about $1. It's probably got a patent on it, but it just works really well. There's tick spoons. I don't have as good luck with that. We have those in our emergency department. You should not use a match. You can try, while you're waiting to find your tick key or tweezers, you can try to circle the tick with a Q-tip. I was completely floored when someone showed me how to do this 10 years ago, and I use it ever since, and I get about a 25 to 50% success rate. Sit there, circle the tick close to it like you're circling with a pin, like you're using a pin, except you're using Q-tip. Have you done this before, Natalie? Mm-hmm. And it's crazy, about the quarter of the time the tick just starts crawling around. I think you aggravate it so much that it starts to remove from the skin. So you can find that out there as well in the literature. It doesn't work very well on dogs. I've tried it. The dogs move too much and they have too much hair to get in the way. We're unfortunately out of time. This has been awesome. We're going to have you back in the late summer or so if you would be willing. And hopefully, Natalie and I were talking before we went live here. We'd love to do some in-person things once the 4th of July gets by and we can start getting out in the public. So let me just end here and say thanks everyone for joining us this week. Thank our guest, Dr. Natalie Quitt. Thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, Ashley Jowett from Southwestern Vermont Healthcare, who helped make this program. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity. We have some exciting shows coming up, and we'll see you next week.